Is this the end of hair transplants? There is a new topical drug called PP405, which is being hyped as a cure for hair loss. But is it real science or just an internet wishful thinking? Today, we break down the mechanism, clinical data, the timeline, and whether hair transplants will really become obsolete. So PP405 is a promising drug and it works differently compared to our finasteride or minoxidil, which is huge, but it is still in clinical trials. So mind you, it's not a proven cure yet. So PP405 is a topical small molecule which is being developed by UCLA research and it's been advanced by Pelage Pharmaceuticals. It's applied to the scalp as a gel and it's designed to reactivate even dormant hair follicle stem cells rather than change the hormones or just increase the blood flow. So, what is its mechanism? PP405 inhibits the mitochondrial pyruvate carrier, which is known as the MPC, which is present inside the hair follicle stem cells. Now, this shifts the cell metabolism. There will be more glycolysis, more lactate, and LDH activity, which eventually pushes the dormant hair follicles out of rest into a growth phase. Now, this is like a metabolic wake up, a different approach from finasteride and minoxidil. Before moving on to the phases of clinical studies, I would like to explain to you what these four phases are. So, phase 1, we check the safety and dose of the drug. So, basically, we use a very small number of people for phase 1 trials. In phase 2 trials, we see the efficacy. We do a little dose refinement. We can do randomized trials. We can do a placebo versus the drug trials. So in phase 2, again, we have a larger number of people. In phase 3, it's a large pivotal trial. It's to prove efficacy, to get data of the adverse effects. And here, we use hundreds to thousands of patients. In phase 4 trial, it's basically the post-marketing, the real-world surveillance after approval of the FDA to catch the rare and the long-term side effects which can occur about the drugs. So now that we know about these four phases of clinical trials, I wanted to know where PP405 stands. So Pelage has presented a phase 1 translational data at the AAD showing activation of the stem cells markers, that is Ki67 and some LDH changes in human samples. Now that's proof of the mechanism and the safety signals. Those results were presented as abstracts or press releases and there is no published data about it. If you talk about the next trial that they did, it was a phase 2A randomized trial. It was a small, short duration trial and it also reported encouraging results. A subset of participants showed meaningful increases in hair density within 8 weeks of using the drug. But the study again was short term. It had a relatively small sample size. So we cannot tell about it. So we are actually waiting for data to come from the phase 3 trials to really prove the efficacy of this drug. So the bottom line is we have early human data which is promising and mechanistically convincing. But we do not yet have large phase 3 data or any journals which have published this article on the efficacy on PP405. Most of what's public are the company's press releases and conference abstracts so far. So Pelage Pharmaceuticals have come up with a timeline as to when they think they are going to roll out the drug. So in 2026, they want to start with the phase 3 trials and the drug may be available in the market by 2030 or 2032. Now that's a long time for us to wait. Now it could be worth the entire wait because if PP405 reliably reactivates dormant but intact hair follicles, many people with early to moderate androgenetic alopecia could regain their density without going for hair transplant surgery. That would reduce the number of people needing hair transplants in the future, and this could become the number one first line regenerative therapy. So I'll keep track, I'll keep following the data and will update you when the phase 3 trial results arrive. If you like these evidence deep dives, hit the like button, share this video, and I'll put all the sources and links from which I've got this information in the description for you to check out. If you don't already know me, I am Dr. Nelly Gonsalves and I'm a dermatologist. And on my channel, I break down the latest advances in dermatology and aesthetics. I talk about all things skin care in a very simple way, easy for you to understand. So if you want to stay updated on everything new from breakthrough treatments to evidence-based skincare, make sure you stick around, hit the subscribe button to follow my channel. Your support helps me reach more people and bring you even better content. So see you in the next one.